Good afternoon. All right, so we'll get ready to begin soon. Thank you so much for being here. This is the Medicaid redetermination event, and I'd like to introduce the Maryland Secretary of Health, Laura Hererra Scott. Laura, please, if you'd like to. She's going to say a few words, and we'll begin. Thank you.
Good afternoon, everyone, and thank you all so much for being here today. I'm Dr. Laura Hererra Scott. As was mentioned, I'm the new Secretary of Health for the state of Maryland, and on behalf of Governor Moran, Lieutenant Governor Miller, as well as my fellow state leaders and healthcare representatives gathered here today, I'm here to highlight an important message for Marylanders on Medicaid. It's time for a Medicaid check-in to redetermine or reapply and reassess your eligibility for health benefits. I appreciate the multi-agency and stakeholder collaboration in this effort, and thanks Secretary Lopez, Chair Peña-Melnyk, which I'm not sure where she is, over there, Deputy Secretary Moran, Executive Director Eberle, and Kathlyn on behalf of Maryland's managed care organizations for joining us today for this important message. It may be a simple message, but for many it's a challenging, complex topic. We formed this coalition on this stage in the hope that no Marylander loses their health coverage because they were not aware that it's time to reapply or reassess your eligibility for coverage. The collective effort includes the Department of Health, Maryland's managed care organizations, so thank you all, the Maryland Health Connection, and the Department of Human Services, and the Chesapeake Regional Information for Our Patients, the state's designated health information exchange. We appreciate your essential contribution to spreading the word about the restart of renewals, and we are holding the event in 2 languages to ensure this message reaches as many Marylanders as possible. We are grateful for the Governor's Office of Deaf and Hard of Hearing for providing sign language and live captioning services today. The federal public health emergency ends today. While we remain committed to fighting COVID-19, we recognize this milestone brings change. This includes the return of Medicaid renewals. Almost 1.8 million Marylanders are on Medicaid. We understand the redetermination process is new for Marylanders who qualified for Medicaid during the pandemic. For many on Medicaid, it's a return to normal routine, but a routine they have not seen for quite a while. But time has passed, and a reminder to renew is critical, so our neighbors or loved ones on Medicaid don't lose their health insurance. Please check in with them to make sure they are ready to reapply. We are not taking this task lightly. Maryland's managed care organizations are leading the charge in spreading the message. They're working with the Department of Health, the Department of Human Services, along with other state agencies on a comprehensive communication campaign that has been developed to spread the Medicaid check-in message to all corners of our state. From digital billboards and social media to television and radio commercials, direct mailings and text messages, we are blasting the message into a multimedia megaphone. We also recognize the importance of bringing health equity into the equation. That includes putting printed informative flyers directly into people's hands, having pastors at Sunday service spread the news about Medicaid renewals, and working with local grassroots organizations to provide information face-to-face. We plan to use every tool possible so no Marylander on Medicaid faces a health emergency only to learn then that they no longer have health insurance. This is the scenario we must avoid. That is why we are all here today. But we can't do this alone. We need all Marylanders to help their friends and family members throughout the process and remind them about their upcoming renewal. The Moore-Miller administration's goal is to ensure that no one is left behind, and we will do everything we can to live up to that promise. If you have any concerns, please visit maryland-health-connection.gov/check-in. If you prefer to call, the number is 855-642-8572. We can offer assistance over the phone in more than 200 languages. Relay services are also available for the deaf and hard of hearing. At this point, I want to share a message from Chair of Maryland's Senate Finance Committee, Senator Melanie Griffith. Though she could not be here today, she wanted to share the following message. Maintaining health coverage is so important to maintaining health and wellness. If you are a Medicaid recipient, please be sure to keep your information updated and respond to mail when it is time to renew so that you can keep your Medicaid coverage if you are eligible. We appreciate the continued efforts of the redetermination campaign, and once again, thank you for your partnership in getting the word out on this important message. I'd now like to introduce Maryland Secretary of Human Services, Rafael Lopez.
Good afternoon, and thank you. My name is Rafael Lopez, and I serve as the new Secretary of the Department of Human Services. I first want to begin by thanking our Secretary of Health, Hererra, and the Executive Director of the Maryland Health Benefit Exchange, Michele Eberle, for their leadership. I'm grateful to be here with you today to share a little bit about how our department is partnering with our sister departments and working hard to ensure that all Marylanders continue to receive their Medicaid or medical assistance benefits. Given the uncertainty we all experienced with the onset of the COVID-19 pandemic, Congress did the right thing by making sure states didn't remove people from the Medicaid program once they had enrolled. This strategy ensured more people could keep their health coverage when they needed it most. Now, as the rules have changed, we want to make sure we avoid people losing their coverage. We don't want a single person to experience a disruption with their healthcare coverage. We want to make sure that everyone receives the support they need to complete their eligibility renewal. And we can't do this on our own, as the Secretary just said. We'll need the help of each of you to help spread the word. And why? Because if you receive Medicaid benefits and do not complete the renewal or provide incomplete information, your coverage may be terminated. When you lose Medicaid coverage due to a failed renewal, you may be left without access to necessary medical care, medications, and other necessary treatments. You may also face financial hardship if you're required to pay out of pocket for these services or if you're unable to work due to your health condition. Losing Medicaid coverage can lead to negative health outcomes. And we don't want people to struggle with access to regular medical care, which can ultimately lead to hospitalization and other more serious health issues. We don't want this to happen to any Marylander, especially for those who rely on Medicaid as their primary source of coverage. Our goal with this new Medicaid Check-In campaign is to help you avoid all of this. We know that when we work together, we can do anything, and we need your help. We need you to be a proactive partner with us to make sure you don't lose your Medicaid coverage. We need you to do 3 things. 1, check in with us. Make sure we have your current mailing address, phone number, email, and other contact information so that we can keep in touch with you. If you have Medicaid coverage through the Department of Human Services, you can update your contact information online. Individuals may also submit a change of address at any of our local departments across the state of Maryland, or local departments of social services, across the state, or local health departments. 2, stay informed about changes to Medicaid eligibility. Follow us on social media, for example. We are at MD Human Services on Facebook and Twitter. Visit our website at www.marylandhealthconnection.gov/check-in for the latest information. Number 3, complete all necessary paperwork and submit it on time. If you receive coverage through DHS, watch your mailbox for a renewal notice from us. And when you get it, please fill it out and get it in on time. We're happy to help you. If our financial circumstances have changed significantly since the last time your case was reviewed, you may no longer be eligible. We want to make sure we work with you to figure that out. If you are no longer eligible for Medicaid, low-cost health insurance options are available. We hope to reach all Marylanders served by DHS who receive health coverage through the state's Medicaid program. While we are focused on Medicaid today, we also want to make sure to mention some of the important work we are doing to make sure Marylanders receive help when they need it most. As you know, thousands of Marylanders have been affected by national schemes and thieves who have stolen SNAP and cash benefits from EBT cards. We're happy to share that Maryland is the first state in the nation to make sure that stolen benefits are replaced. As of this morning, more than 8,000 families have already received over $5.2 million in replaced stolen benefits, and we're thrilled to partner with all of you to make sure that happens. We need your help to spread the word and encourage families impacted by EBT fraud to visit our website, dhs.maryland.gov, and file a claim to recover their stolen benefits, especially if your benefits were stolen between October 1st of 2022 and February 28th, 2023. The deadline to file a claim is May 31st of this year. Please don't miss out on this opportunity. Visit the DHS website, as I've mentioned, or visit our local departments of social services to start a new claim. I'll close by reminding everyone to check in, stay informed, and complete your paperwork. Whether re-enrolling for Medicaid coverage or recovering your stolen benefits, we're happy to help you, and we don't want you to miss out. Thank you again, Secretary Hererra and Executive Director Eberle, for your leadership in helping Marylanders remember to check in. And now I'm happy to do this in Spanish, so please bear with me. Muy buenas tardes. Mi nombre es Rafael Lopez y soy el secretario del Departamento de Servicios Humanos. Deseo agradecer a nuestra secretaria de Salud, Laura Hererra, y la directora ejecutiva del Intercambio de Beneficios de Salud de Maryland, Michele Eberle, por su liderazgo. Queremos compartir con ustedes cómo se está esforzando nuestro departamento para garantizar que todas las personas en Maryland continúan recibiendo sus beneficios de Medicaid o asistencia médica. Debido a todo lo que enfrentamos con el inicio de la pandemia de COVID-19, el Congreso hizo lo correcto al asegurarse de que los estados no les cancelaran el programa de Medicaid a muchas personas después de haberse inscrito. Esta estrategia garantizó que más personas pudieran mantener su cobertura médica cuando más lo necesitaban. Hoy en día, debido a que las reglas han cambiado, queremos asegurarnos de que nadie pierda su cobertura. No queremos que nadie sufra una interrupción en su cobertura médica y queremos asegurarnos de que todo el mundo reciba la ayuda necesaria para poder completar su renovación de elegibilidad. Pero no podemos hacer esto solos. Nosotros vamos a necesitar su ayuda para informarle a todo el mundo. ¿Y por qué? Porque si usted recibe beneficios de Medicaid y no completa la renovación o la información que ofrece la información está incompleta, disculpe, su cobertura puede ser cancelada. Si usted pierde su cobertura de Medicaid por no completar su renovación, puede perder el acceso a la atención médica necesaria, medicamentos y tratamientos. Usted también podría tener dificultades económicas si tiene que pagar de su bolsillo por esos servicios o si no puede trabajar por un problema de salud. Perder la cobertura de Medicaid puede tener consecuencias negativas para la salud, especialmente para aquellos que padecen enfermedades crónicas, y nosotros no queremos que además tengan dificultades para acceder a una atención médica regular, ya que eso podría provocar la hospitalización y otros problemas de salud más graves. Nosotros no queremos que esto le pase a nadie en Maryland, especialmente a quienes dependen de Medicaid como su principal fuente de cobertura médica. Nuestra meta con esta nueva campaña de registro de Medicaid o Medicaid Check-In es ayudarle a evitar todo esto. Sabemos que cuando trabajamos juntos podemos hacer lo que sea y necesitamos su ayuda. Nosotros necesitamos que usted nos colabore para que no pierda su cobertura de Medicaid. Para eso, necesitamos que usted haga 3 cosas. Primeramente, se reporta. Verifica que tenemos su dirección del correo, número de teléfono, correo electrónico y otra información de contacto actualizada para que podamos comunicarnos con usted. Si usted tiene cobertura de Medicaid a través del Departamento de Servicios Humanos, puede actualizar su información de contacto en línea. También se puede reportar un cambio de dirección en cualquiera de nuestros departamentos de servicios sociales locales o en los departamentos de salud locales por todo el estado. Segundo punto, por favor, que se mantenga informado sobre los cambios de la elegibilidad de Medicaid. Síganos en las redes sociales. Por ejemplo, estamos en @MD-Human-Services y también en Facebook y Twitter. Visítanos en la red en www.marylandhealthconnection.gov. Complete todo el papeleo necesario y entrégaselo en tiempo, por favor. Si usted recibe cobertura a través del DHS, revise si ha llegado a su buzón del correo un aviso de renovación que nosotros le enviamos. Cuando reciba su aviso de renovación, no espere. Responda inmediatamente, por favor. Si sus circunstancias económicas han cambiado de manera significativa desde la última vez que su caso fue revisado, es posible que ya no cumpla con los requisitos de elegibilidad. Si usted ya no es elegible para recibir Medicaid, puede haber disponibles opciones de seguro de salud a bajo costo. Nosotros esperamos hacer llegar la información a todas las personas en Maryland atendidas por el DHS que reciben cobertura médica a través del programa de Medicaid del estado. aunque hoy estamos enfocados en la cuestión de Medicaid, también queremos mencionar y compartir algo del importante trabajo que estamos haciendo para asegurarnos de que los habitantes de Maryland pueden recibir ayuda cuando más lo necesitan. Como ustedes saben, miles de personas en Maryland han sido afectados por esquemas de trampas y ladrones que les han robado sus beneficios de SNAP y efectivo de sus tarjetas de EBT. Hoy nos complace compartir que Maryland es el primer estado en los Estados Unidos que ha garantizado el reembolso de los beneficios robados. Hasta esta mañana, más de 8,000 familias han recibido más de $5.1 millones en beneficios reembolsados. Necesitamos que ustedes nos ayuden a divulgar la noticia y animen a las familias impactadas por el fraude con la tarjeta EBT a que visiten nuestro sitio del web, dhs.maryland.gov, y presenten una reclamación para recuperar sus beneficios robados, especialmente si sus beneficios fueron robados entre el 1 de octubre del 2022 y el 28 de febrero de este año, del 2023. La fecha límite para presentar una reclamación es el 31 de mayo de 2023. Por favor, no pierdan esa oportunidad. Visiten el sitio web del DHS, como he mencionado, o visiten nuestros departamentos de servicios sociales locales para presentar una nueva reclamación. Quiero terminar recordándoles a todos, primeramente, regístranse, segundamente, mantenerse informados y al final completar el papeleo necesario, ya sea para reinscribirse en la cobertura de Medicaid o para recuperar sus beneficios robados. Nosotros estamos aquí para ayudarles y no queremos que pierdan esta oportunidad. Gracias a la secretaria Hererra y directora ejecutiva Eberle por su liderazgo y además por ayudar a todas las personas en Maryland que no olviden registrarse. Muchas gracias a todos. Ahora quisiera presentar al Delegate Peña-Melnyk. Please join me in welcoming Delegate Peña-Melnyk.
I try to stay out of the sun. I'm from the island, but this island girl doesn't do well with the sun. So good afternoon, everyone, and thank you for allowing me to be here. I would like to thank Secretary Hererra, Secretary Lopez, Michele, Eberle from the Exchange, and everyone of the Department of Health and the Department of Human Services for including me in this wonderful event. It is important that we're here today because we have to spread the word. It's really important. As many of you know, health equity is a personal passion of mine and the main motivation behind what I do, everything I do on the Health Committee. Health equity means creating the conditions in which everyone, I mean everyone, as the governor says, leave no one behind, has a fair and just opportunity to attain their highest level of health. Achieving health equity requires our focus on overcoming economic, social, and the other obstacles to health and healthcare. This includes ensuring that every person maintains access to health insurance. Without health insurance, they cannot go to the doctor. Without health insurance, they end up at the hospital. Without health insurance, the hospitals spend millions of dollars because people do not have insurance. And without health insurance, people are very sick when they're diagnosed with cancer or very serious illness. Before the pandemic, just to give you some perspective, we had 1.3 million people approximately on Medicaid. After the pandemic and during the pandemic, we're now at 1.8 million. That's a lot of people. Imagine if they fall off the rolls. Imagine what that would do to every system. So Marylanders currently enrolled in Medicaid will receive a notice from Medicaid about their coverage. Not everyone will be up for renewal at the same time. This is important. You will receive a notice in the mail or in your online account when it's time for you to renew. When you get your notice, you will have 45 days to respond. That's a lot of time. There's no excuse for you not to do it. Read it carefully. This notice will tell you how to complete your renewal and what you need to do if you're eligible. What can go wrong if this doesn't happen? You can find yourself without health insurance and unable to afford the care that you need. It is extremely important to be aware of the renewal process. Don't call my office, please. I know you do, because your problem is not my problem. You have time to renew it. We're telling you how to renew it. It is important for you to do it so you don't lose that coverage. We are concerned, and I know my colleagues up here are concerned, and so are my colleagues in the General Assembly, about the disproportionate impact of people of color. People of color are more likely to experience instability in employment and housing, increasing the likelihood that these individuals could, for example, not receive their renewal notice and lose coverage during the redetermination process, because they're mostly affected by those social determinants of health, and we saw that during COVID. The data did not lie. The science is real. It is important that no one experiences a gap in insurance coverage during this period. Fortunately, we care. So we're here today to try to make a difference. So each and every one of you, we have probably 50 people here, more than that. Each of you has access to Facebook, Twitter, Instagram, TikTok, whatever your pleasure is. Make sure that you take a picture and you put it out there on social media. Make sure that if you go into the community, you do the same and spread the word. It's important. I am going to do this in Spanish, so bear with me. Buenas tardes, estoy muy agradecida de estar aquí. Mi nombre es Joseline Peña y soy la presidenta del Comité de Salud y Operaciones Gubernamentales. Le quiero dar las gracias a la secretaria Hererra, el secretario Lopez, Michele, Eberle y al personal del Departamento de Salud y el Departamento de Servicios Humanos por incluirme en este evento. And I see the Spanish media here, which is wonderful. And can I just say how wonderful it is to have this diversity in a bilingual press conference? It's amazing. Thank you. And I've been here 16 years. This is the first one. Como muchos de ustedes saben, la equidad en la salud es mi pasión y la principal motivación detrás del trabajo que hago. Equidad en salud significa crear las condiciones en las que todos tengan igualdad de oportunidades para alcanzar el más alto nivel posible de salud. Para lograr equidad en la salud debemos enfocarnos en superar obstáculos económicos y sociales que impactan la salud y el acceso a la atención médica. Esto incluye garantizar que todas las personas tengan acceso a un seguro de salud. Antes de la pandemia, nosotros teníamos aproximadamente 1.3 millones de personas que estaban recibiendo el seguro de salud público de Medicaid. Hoy día tenemos aproximadamente 1.8 millones de personas. Son muchas personas que si no hacen lo que le estamos diciendo hoy día y no renuevan su aplicación, se van a quedar sin seguro. ¿Y qué sucede cuando usted se queda sin seguro? Cuando usted se queda sin seguro, usted termina yendo al hospital. Y el hospital tiene esos gastos que no puede recuperar. Y esos gastos afectan a toda la población. Pero no es solo el gasto, es también su salud. Que es más fácil curar a una persona al principio que después cuando le dicen que tiene un cáncer o una enfermedad que es bastante seria. Los residentes de Maryland actualmente matriculados en Medicaid van a recibir un aviso sobre su cobertura. Por favor, cuando la reciba, preste atención, revise ese aviso en el correo para que pueda renovarla a tiempo. Le van a dar 45 días. 45 días para responder, que es suficiente. Si usted no responde, es su culpa. No llame a mi oficina, ¿ok? Porque su problema no es mi problema. Le estamos dando aquí la oportunidad de usted hacerlo correctamente, ¿ok? Por favor, lea atentamente su aviso. Es extremadamente importante ser consciente del proceso de renovación. La gente que se ha mudado, inmigrantes, individuos que no hablan inglés o individuos con discapacidades son las poblaciones que corren riesgo de mantener la cobertura durante este periodo. La pérdida de cobertura le va a afectar a usted grandemente. Por favor, haga lo que le estamos diciendo. Estas poblaciones que hablamos de las personas latinas, los inmigrantes, esas son las poblaciones que yo represento y las conozco muy bien y por eso estoy aquí hoy día. Así que afortunadamente mis colegas que estamos aquí presentes y en la Asamblea General, a nosotros nos preocupa, a usted, de verdad que sí. Y por eso le estamos diciendo que trabajemos juntos y que usted preste atención a su carta cuando le llegue y que haga la redeterminación. para que usted pueda tener la cobertura. Es muy importante. Aquí tenemos más de 50 personas. Ustedes todos pueden irse a las redes sociales, al Facebook, al Twitter, al Instagram, al TikTok, y usted puede hoy día anunciar esta rueda de prensa y explicarle y decirle a las personas la importancia de tener la cobertura. Mil gracias y bendiciones. Thank you so much and God bless you.
Thank you, Delegate Peña-Melnyk, for your extraordinary leadership and a champion in this state. Good afternoon, everyone. My name is Ryan Moran. I'm the new Deputy Secretary for Healthcare Financing and the state's Medicaid Director here in Maryland. I would like to echo the sentiment from many of the colleagues that have already expressed gratitude to the managed care organization representatives that are represented here today for their exceptional contributions and partnership with the department in the past 3 years. During the public health emergency, we witnessed an increase in Medicaid enrollees who received quality care during a challenging time. As jobs were lost due to the pandemic hardships, many families across the state had to scramble for the next paycheck. But we did our best to ensure that every Marylander in need had the opportunity to enroll and receive immediate healthcare solutions and coverage. As Secretary Hererra Scott and others have discussed today, the Maryland Department of Health, together with the Maryland Health Connection and the Maryland Managed Care Organization Association, we've launched a comprehensive campaign to inform every Maryland resident about the return of the Medicaid Check-In process. This campaign, called Medicaid Check-In, involves various forms of advertising, and it's a robust campaign that runs across the course of the next year through April of 2024. And this is the chief goal, to make sure that every Marylander on Medicaid stays informed and remains covered if eligible. While many Marylanders will maintain coverage, some may not qualify. And frankly, we do not expect everyone on Medicaid right now to qualify, and that's because many families who have endured job losses and misfortunes during the pandemic, they're now back on their feet. Some are in a better financial situation than they were 3 years ago. And another element is age. Any Marylander on Medicaid who turns 65 years old over that time span is now eligible for Medicare. And for those who are no longer eligible for Medicaid, there are affordable options available through the Maryland Health Connection. We urge all Marylanders who have Medicaid to update their contact information. This is our plea, so that you can receive important health insurance renewal information. The notices are being sent by mail and email several times in the coming months. And once you receive a notification, you have 45 days to respond. Our partners understand that the best way to reach people is through direct communication. That's why this assembled coalition of healthcare leaders today have made sure that we send multiple reminders to each member during the enrollment period. This includes the channels of communication of text messages, emails, and robocalls. There's direct mailings for folks who may not feel comfortable with smartphones or the internet. And this process, as mentioned, will continue over the next year. Social media and digital billboards are part of our advertising strategy. They're posted everywhere across the state, and television and radio ads have hit local airwaves. All have the same message: Maryland, it's time to check in. I encourage all Marylanders to take advantages of the many resources that are available on our website to address the specific questions that you may have. But we also want to take this time to remind people to stay vigilant. Please be mindful and cautious of fraudulent text messages, emails, and phone calls. Unfortunately, scammers are already targeting people in other states. It's important to remember that Maryland Medicaid and our administration will not ask you for payment or personal banking information during this process. It's essential that you avoid sharing sensitive information with anyone requesting these items. While valid text messages are being sent from our offices concerning updates, renewals, and surveys, we will never discuss your potential loss of coverage or request a payment directly from you. Also want to take this opportunity today to officially announce that our website will provide Medicaid check-in data that is open to the public for easy access on statistics related to resuming renewals, and the eligibility redetermination process. The most important thing from today is to ensure that all Marylanders on Medicaid monitor your mail, your email, your text messages, and respond right away so that no one who is still eligible for Medicaid loses coverage because they didn't know that they had to reapply. We are counting on you, each and every Marylander, to help us get the word out to our family and friends to ensure that we can do our part to ensure that in this state, no one is left behind. Thank you for joining us for spreading the word on the redetermination process.
Thank you. Good afternoon, everyone. I'm Michele Eberle, and I'm the Executive Director for the Maryland Health Benefit Exchange. And I want to start by thanking Secretary Hererra Scott and Secretary Lopez for the opportunity to be up here today and share this important information with you. They may be new in their roles, but I can assure you that the passion they're bringing to their jobs is just phenomenal, and it is truly an honor to work alongside them in this effort. We are all about letting everybody know it is time to check in and make sure all your data is correct and that we have your phone number, your income information, everything we need to know to reach you and to make your process of renewals simple and easy. All of us here are dedicated to making sure that everyone who is no longer eligible for Medicaid stays covered in whatever health plan is best for them and their family. In Maryland, most Medicaid recipients obtain their health insurance through Maryland Health Connection. What's different about Maryland is that throughout this entire public health emergency, we have stayed in contact with our Medicaid recipients. We've continued to send notices, we've continued to communicate, social media, so we've stayed in touch. That is unique to Maryland. There's many states across the nation where that has not occurred. So we're pretty proud of that. We are now even wrapping up those communications much further. You've heard from others today of the social media efforts going on, likewise through Maryland Health Connection using our Twitter, Facebook, and other social media channels. We are reminding Medicaid recipients to update their information through Maryland Health Connection. Now, each individual and family who may no longer be eligible for Medicaid will receive a special notice from Maryland Health Connection that explains what health coverage they qualify for. They will receive that notice in the mail or electronically if they've chosen our paperless option. We also will be sending them emails and text messages for those who have provided that contact information. And again, our goal is to reach people wherever they are at and in whatever form resonates most with them. We also have our call center. We have over 200 languages available through our call center. We have many bilingual Spanish-speaking customer service reps. They are at the ready to help people get through this process of enrollment, re-enrollment, or into a new health plan. For those that may no longer be eligible for Medicaid, but now qualify for a low-cost or no-cost private plan through commercial insurance, we have a whole host of insurance agents across this state who have the expertise to help folks navigate that road into private commercial health plans, and that is at no cost to our consumers. So we know some people may be going into employer coverage, some may be going into Medicare, many will stay in Medicaid, and then also will go into private plans. It's important to note that approximately 50% of our Medicaid recipients that are eligible for Medicaid are auto-renewed. So they will not have any lapse in coverage. We auto-renew them. Once we confirm their eligibility, they're auto-renewed. Everything will stay seamless for them. And that's really a terrific percentage when we're looking at who we're trying to reach. The leaders you see here represent a group of people who have been working diligently to make it as easy as possible for Marylanders to stay covered. Maryland is just one of a few states in the nation implementing a program to simplify the transition from Medicaid to private health plan. California, Rhode Island, and Maryland are the only 3 states that are having a pathway for folks rolling off of Medicaid to get enrolled into a qualified health plan. How that is going to work is that if they're no longer eligible for Medicaid, we will let them know which private plan we believe may be the best value for that person and or their family, and we'll start that process to enroll them into that new plan. We'll send them a notice. We will do everything except close that enrollment, because we do feel it's very important for our consumers to make that choice for what plan they want to go into, what carrier they want to go into. So we'll do everything for them other than paying their bill and making that selection of where they're going to end. So again, just another effort by Maryland to say, we know people will be rolling off Medicaid. Let's make sure we're getting them into some coverage. As you heard Delegate Peña-Melnyk talk about how critical having health coverage is for our citizens in the state of Maryland. Ensuring Marylanders have health coverage is so important to each of us here today. Not only does it protect folks from financial loss and the unexpected, but it allows all of us and all of Maryland citizens to stay healthy and improve their well-being, which is a really good thing for our state. I want to thank our MCO partners who we work with very closely, our commercial insurance carriers who also are prepping for any folks that will come over from Medicaid, and really working collaboratively as a state to make sure that we do not leave anyone behind, as Governor Moore says so often. Thank you. With that, I'll introduce Kathlyn.
Good afternoon, everyone. First, thank you to Secretary Hererra Scott, to Secretary Lopez, Chair Peña-Melnyk, Deputy Secretary Moran, and also Executive Director Michele Eberle for inviting me and my colleagues to join today's event. My name is Kathlyn. I am the CEO of United Healthcare Community Plan of Maryland. I am also the board chair for the Maryland MCO Association. And I want to acknowledge, I'm here today to represent the 9 MCOs that serve Medicaid members here in the state of Maryland. I want to acknowledge my 8 counterparts, the 9 CEOs of the Health Choice Health Plans who are all sitting here today, if you guys want to wave. So just thank you all for being here. We as the 9 MCOs, we really deeply appreciate the commitment of the leaders of the state of Maryland, the speakers that you've heard today, to make the commitment to make every preparation possible to help Marylanders take action when they need to do so to maintain their healthcare coverage. As a group of us, over a year ago, we made a commitment to support the Medicaid Check-In campaign with the Maryland Department of Health to make sure that our members know to renew when they are due. To all of our Medicaid members, look out for mail, phone calls, emails, text messages from the Maryland Health Connection, and also from the 9 of us, your MCO. We will let you know when it's your turn. And when it is your turn, please come to the Maryland Health Connection at marylandhealthconnection.gov to renew your coverage. If you are still eligible for the Medicaid program, you're going to receive assistance to stay with us, and we want you to stay with us. If you are no longer eligible for the Medicaid program, the good people at the Maryland Health Connection will help you with your other options for health insurance coverage so that you can maintain your coverage. Thank you all so much for being here today to help all of us get this important message out to our members who need it. Thank you.
Well, thank you all very much. That concludes the speakers we have. I don't think I introduced myself at the beginning. I was a little nervous. My name is Chase Cook. I'm the Acting Director of Communications, and I'm the man responsible for making you all sit in the sun for 40 minutes, so thank you very much. I very much appreciate it being here. I love Lawyers Mall, and I'm very proud to have an event here. Do want to open it up just for a few minutes for media questions if there are any. Is there any questions in the audience from the media? Brian?
I was wondering if someone might be able to say how many Maryland residents would, if there's an estimate as to how many could possibly lose coverage?
So we don't have a number on that. Again, as Michele described, we've been sending messages real time. We know at least half will keep their coverage based on what we've been doing to date. But our goal is to keep as many covered in with their managed care organization as possible. And if not, they'll have options to work with the exchange for either employer-sponsored health plans or other options through the exchange.
Ms. Eberle, during the legislative session, had said, given an estimate to the Senate Finance Committee, that it could be as high as 80,000. Is that no longer really believed to be the number?
We just don't know for sure. I mean, it's a moving target at this point, and so we don't want to, commit to a number, except the reason why the 9 MCOs are here, as well as everyone here, is to make sure that people that are due to re-enroll know what they need to do, and make sure they fill the paperwork however it gets to them, so we can ensure as many Marylanders as possible keep their coverage.
Anything else, Brian? Anybody else with questions? What am I seeing? Oh, hi, yes, hello.
Yes, what if somebody for some reason doesn't move and did not change their information, finds out that they have lost their insurance, can they reapply?
If they don't have their address, can they reapply? Absolutely. So the same criteria, if someone has moved, they should let us know, especially if they have a Medicaid card and they think they've changed address since the last time they had to do this process. And as was already stated, if they did it for the first time during COVID and they've moved and they don't remember exactly when, it's best to just let us know what their new contact information, so we can make sure that they get the application and the notices to reapply. But absolutely, even if they've moved and the coverage lapsed and they learn because they've lost their coverage, going to a provider, that will be their cue that they need to connect with their managed care organization and reapply for their benefits.
Any other questions? I'm not saying I want to miss anybody. Well, then I think that'll conclude our event. I just want to thank again all of our managed care organization CEOs and executives here. Thank you guys so much for being here. Thank you so much to our speakers. This is wonderful. Delegate Peña-Melnyk, thank you for coming and being a part of this. There are copies of our press release. There are copies of our flyers in English and Spanish at the table over there. There's water, other information you need, and I'll be milling about helping clean up if you need anything from me. So thank you all very much, and have a wonderful day.